Look at your skin for just a moment. Not tomorrow, not after this video, right now. Because one small bump that you've ignored for years could be completely harmless, or it could be the first warning sign that something deserves a closer look. The truth is, once we pass the age of 50, our skin begins to change in ways most people never expect. Tiny growths appear on the neck, rough patches develop on the back, small red spots suddenly show up on the chest, soft lumps seem to appear overnight. Most people assume it's simply part of getting older, and in many cases they're right. But not always. The challenge is knowing which bumps are perfectly normal and which ones should never be ignored. Today we're going to uncover 10 of the most common skin bumps that appear after the age of 50. You'll discover why they happen, what they usually mean, when they're harmless, and the warning signs that tell you it's time to have them checked by a medical professional. Stay with me until the end, because one of these skin changes is often mistaken for something harmless, when in reality it may require urgent medical attention. Let's begin with one of the most common skin growths of all, skin tags. If you've ever noticed a small, soft piece of skin hanging from your neck, under your arm, around your eyelids, or beneath the breasts, there's a good chance it's a skin tag. They often appear gradually, almost without you noticing. One day your skin is smooth. A few months later, there's a tiny flap of skin that seems to have appeared from nowhere. For many people, this can be alarming. Some even worry it's cancer. Fortunately, skin tags are usually completely harmless. They're simply small overgrowths of normal skin. Doctors commonly see them in areas where skin rubs against skin or clothing. That's why they're especially common around the neck, armpits, groin, and other areas of friction. As we grow older, skin tags become increasingly common. They also appear more frequently in people who have a family history of them, and they're often seen alongside conditions linked with insulin resistance. Most skin tags never cause any medical problems. The only time they become troublesome is when they catch on jewelry, clothing, or shaving equipment, causing irritation or bleeding. Many people try removing them at home using scissors, rubber bands, or products purchased online. While some people may never experience complications, attempting to remove skin growths yourself carries a risk of infection, unnecessary scarring, or even mistaking a more serious lesion for a harmless skin tag. If a skin tag suddenly changes color, becomes painful, bleeds repeatedly without being caught, or grows unusually quickly, it's worth having it examined by a healthcare professional rather than assuming it's harmless. Now here's something many people don't realize. Not every brown bump that appears with age is a skin tag. Some are something entirely different. And that's where the second skin bump comes in, seborrheic keratosis. The name sounds intimidating, but this is actually one of the most common harmless skin growths seen in older adults. Many people call them age spots, wisdom spots, or even barnacles of aging. They usually look as though someone has placed a small waxy patch onto the surface of the skin. They may be light brown, dark brown, gray, or almost black. Some feel rough, others are smooth, some are tiny, others slowly grow larger over many years. Because of their appearance, they're often mistaken for warts or even skin cancer. That's why they cause so much unnecessary worry. The good news is that seborrheic keratoses are usually benign. They develop because of natural aging, genetics, and years of accumulated sun exposure. Unlike dangerous skin cancers, they do not spread throughout the body. In fact, many people develop dozens of them as they grow older. Some remain unchanged for decades. Others may slowly thicken or become more noticeable. Although they don't usually require treatment, some people choose to have them removed because they become irritated by clothing or because they simply don't like how they look. However, here's the important part. Never assume every dark raised skin growth is just another age spot. If you notice a lesion that suddenly changes color, develops irregular borders, starts bleeding, becomes painful, or grows rapidly, don't try to diagnose it yourself. Those changes deserve proper medical assessment. Remember, recognizing the difference between harmless aging and something potentially serious could make all the difference. And believe it or not, the next skin bump on our list often starts as something so small that many people ignore it for years, until it begins to hurt every time they touch it. The next skin bump on our list often catches people completely by surprise because it doesn't look particularly worrying at first. It usually starts as a small, firm bump beneath the skin. You might notice it while shaving your legs, drying yourself with a towel, or simply running your hand across your skin. At first, it feels like a tiny pea trapped beneath the surface. It doesn't seem to move. It doesn't disappear. And over the years, it simply stays there. This is called a dermatofibroma. Although it can develop almost anywhere on the body, it most commonly appears on the legs, particularly in women. Doctors believe these bumps often form after a minor injury to the skin, such as an insect bite, a small cut, or repeated irritation from shaving. The body's healing process becomes slightly overactive, leaving behind a firm collection of scar-like tissue. The reassuring news is that dermatofibromas are almost always harmless. They are not contagious, they do not spread throughout the body, and in most cases, they never become dangerous. However, because they are quite firm, they can occasionally become tender if knocked against furniture or irritated by clothing. Some people even mistake them for an ingrown hair or a cyst and repeatedly try to squeeze or cut them away. Unfortunately, that rarely works. Unlike a spot or a blackhead, these bumps sit much deeper within the skin. Trying to remove them yourself usually causes more damage than the bump itself. If one suddenly begins growing rapidly, changes color dramatically, develops persistent pain, or starts bleeding without any obvious injury, it's always worth arranging a professional examination. Fortunately, for the vast majority of people, these bumps remain nothing more than a harmless reminder of the skin's natural healing process. Now let's move to something much smaller. In fact, many people mistake these tiny bumps for ordinary whiteheads. Have you ever noticed tiny white or yellowish dots around your eyes or cheeks that simply refuse to disappear? You wash your face, you use expensive creams, you even try squeezing them. Yet they stubbornly remain exactly where they are. These tiny bumps are called milia. Unlike acne, milia don't form because of blocked pores filled with oil. Instead, they are tiny cysts that sit just beneath the surface of the skin. Each one is enclosed within a small sac, which is why squeezing them almost never works. Even if you manage to force out a little material, the sac often remains behind, allowing the bump to return. Milia are incredibly common as we get older. They may appear after minor skin injuries, cosmetic procedures, sun damage, or simply as part of the skin's natural aging process. The good news is that they are completely harmless. They don't turn into cancer, they aren't infectious, and they don't spread from one person to another. Many disappear naturally over time. Others remain for years without causing any problems at all. If they bother you cosmetically, they can usually be removed safely by a trained healthcare professional using a tiny sterile opening and careful extraction. Attempting to dig them out at home with needles or sharp objects can easily lead to infection, unnecessary scarring, or permanent skin damage, particularly around the delicate eye area. Sometimes the safest decision is simply to leave them alone. But now we're about to discuss a skin bump that often causes far more anxiety because many people confuse it with skin cancer. Imagine looking in the mirror one morning and noticing a small, flesh-colored bump on your nose. At first it seems like an ordinary spot. Weeks pass. It doesn't disappear. Instead, it stays exactly the same. It has a tiny dip in the center and a smooth, shiny surface. Naturally, many people begin to worry. This common skin change is known as sebaceous hyperplasia. Despite the complicated name, it's simply an enlarged oil gland. As we age, the oil glands within our skin can gradually become larger, creating these small, rounded bumps, particularly on the forehead, nose, and cheeks. People with naturally oily skin often develop more of them, especially later in life. Sebaceous hyperplasia is completely benign. It isn't contagious, it isn't caused by poor hygiene, and in most cases, it never requires treatment. However, because these bumps can closely resemble certain forms of skin cancer, they should never be diagnosed purely by looking in a mirror or searching online photographs. If a new facial bump continues to grow, repeatedly bleeds, forms a sore that refuses to heal, or develops unusual blood vessels across its surface, it's always sensible to have it examined by a qualified medical professional. Most cases turn out to be completely harmless, but when it comes to changes on the face, reassurance from an expert is often the best medicine. So far, we've looked at several skin bumps that are usually harmless, but the next condition is completely different. Unlike the others, it's actually caused by a virus. And because of that, it can spread surprisingly easily from one part of the body to another. That's where we'll continue next. Now, unlike the bumps we've discussed so far, the next one isn't simply a result of aging or genetics. It's caused by a virus. And because of that, it behaves very differently. You may first notice a tiny smooth bump that looks almost pearly. It may be flesh-colored, slightly pink, or have a small dimple right in the center. At first glance, it doesn't seem like anything important. In fact, many people mistake it for a pimple or a harmless skin blemish, but over the following weeks, more bumps may begin appearing nearby. This condition is known as molluscum contagiosum. It is caused by a virus that spreads through direct skin-to-skin contact or by sharing contaminated items such as towels, clothing, or sports equipment. Although it is far more common in children, adults can develop it as well, particularly if the immune system is weakened or through close physical contact. One of the biggest mistakes people make is scratching these bumps. Each time the skin breaks, the virus can spread to nearby areas, creating an even larger cluster. The reassuring news is that molluscum contagiosum is usually harmless. For many healthy people, the body's immune system eventually clears the virus naturally. However, that process can take several months, and sometimes even longer. If the bumps become widespread, painful, infected, or appear around sensitive areas such as the eyes or genital region, professional treatment may be recommended to speed up recovery and reduce further spread. The important thing to remember is this: not every cluster of small bumps is acne, and not every viral skin condition requires panic. Knowing the difference allows you to make informed decisions instead of reacting with fear. Now let's move to another skin change that often surprises people because of its striking color. Imagine looking in the mirror and suddenly noticing a small blue or deep purple spot on your lower lip. It almost looks like trapped blood beneath the skin. Naturally, many people assume they've bitten their lip without remembering it. Others worry it could be something far more serious. In many cases, it's actually something called a venous lake. Despite the unusual name, a venous lake is simply a tiny collection of enlarged blood vessels sitting close to the skin's surface. These soft bluish bumps are especially common on areas that have received years of sunlight, including the lips, ears, and face. One simple feature often helps doctors recognize them. When gentle pressure is applied, the bump may partially flatten or become lighter because the blood temporarily moves away. Once the pressure is released, the color returns. Most venous lakes remain completely harmless. They usually don't cause pain and rarely create any medical problems. Some people choose to have them treated purely for cosmetic reasons, particularly if they become more noticeable over time. However, if a blue or dark-colored spot suddenly changes shape, begins bleeding frequently, develops an irregular border, or refuses to heal after repeated injury, it should always be assessed professionally rather than dismissed as another harmless blood vessel. Next comes one of the most common red spots seen after the age of 50. Many people suddenly notice one while getting dressed. Then another appears a few months later. Before long, there may be several scattered across the chest, back, or arms. These bright red bumps are called cherry angiomas. If you've noticed them appearing over the years, you're certainly not alone. Cherry angiomas are tiny collections of small blood vessels that grow close together beneath the surface of the skin. They often resemble little red domes, almost like someone has placed a tiny drop of bright red paint onto the skin. For many people, they seem to appear overnight. The exact reason isn't fully understood, but age and genetics appear to play the biggest role. The reassuring news is that cherry angiomas are among the most harmless skin growths doctors see. They don't spread through the body. They aren't infectious, and having several of them doesn't usually indicate an underlying illness. Occasionally, one may bleed if it's accidentally scratched or caught on clothing because it contains many tiny blood vessels. That can certainly look alarming. Fortunately, a small amount of bleeding doesn't automatically mean something dangerous is happening. However, there is one important rule you should always remember. If any red bump repeatedly bleeds without being touched, rapidly increases in size, develops an ulcer, or begins changing its appearance, don't simply assume it's another cherry angioma. Those are changes that deserve proper medical assessment. At this point, we've explored several skin bumps that are usually harmless, even though they can appear quite alarming. But we've saved one of the most common, and often one of the most stubborn, for last. It's the skin growth that can make every step painful, spread from person to person, and sometimes refuse to disappear for years despite repeated treatments. And surprisingly, most people unknowingly make it much harder to get rid of. The final skin growth on our list is one that millions of people experience at some point in their lives, yet many underestimate just how persistent it can be. It often begins as a small, rough patch on the sole of the foot. At first, it feels like you've stepped on a tiny pebble. You assume it's simply hard skin, perhaps a callus. But as the weeks pass, every step becomes a little more uncomfortable. Eventually, even walking across the room can become irritating. In many cases, this is a plantar wart. Unlike ordinary calluses, plantar warts are caused by the human papillomavirus, commonly known as HPV. The virus enters through tiny breaks in the skin, often after walking barefoot in warm, damp places such as public swimming pools, changing rooms, or communal showers. One reason plantar warts are so often mistaken for calluses is because both become thick and hard. However, there are a few important differences. If you look closely, you may notice tiny black dots inside the wart. These are actually tiny clotted blood vessels. Another clue is the skin itself. A normal callus allows your natural skin lines to continue across its surface. A plantar wart interrupts those lines because the wart grows from within the skin, pushing the normal pattern aside. Although plantar warts are not dangerous, they can be incredibly stubborn. Some disappear within a few months. Others remain for years despite repeated attempts to remove them. They're also contagious. Without realizing it, you can spread the virus to other areas of your own body, or even to other people through direct contact or shared surfaces. Many over-the-counter treatments can be helpful, but they often require patience and consistency. Trying a treatment for a few days before giving up rarely works. Persistent warts often need weeks or even months of regular care. If home treatment fails, becomes too painful, or if you have diabetes, poor circulation, or a weakened immune system, it's especially important to seek professional advice rather than attempting aggressive treatment yourself. And now we've reached the most important message of today's video. Throughout this video, you've seen skin tags, seborrheic keratosis, dermatofibromas, milia, sebaceous hyperplasia, molluscum contagiosum, venous lakes, cherry angiomas, and plantar warts. The remarkable thing is that the vast majority of these skin changes are completely harmless. They are simply part of how our skin changes with time. But here's the mistake that catches so many people. When people hear that most skin bumps are harmless, they begin assuming that every new bump must also be harmless. That assumption can be dangerous. The one skin bump you should never ignore isn't defined by its name. It's defined by its behavior. Any skin growth that is new, grows rapidly, repeatedly bleeds without injury, changes color, develops uneven borders, refuses to heal, forms an open sore, or suddenly begins itching or causing persistent pain deserves medical attention. Those warning signs don't automatically mean cancer. Far from it. Many harmless conditions can produce one or two of those symptoms. But they are your body's way of saying, please don't ignore me. One simple examination by a qualified healthcare professional can often provide reassurance, and if something more serious is present, early detection offers the best possible chance of successful treatment. Your skin is the largest organ in your body. Every mark, every spot, and every bump tells part of its story. Most are nothing more than natural signs of a life well lived. Years spent outdoors, family genetics, the normal process of aging. There's absolutely no reason to feel embarrassed by them. Instead of fearing every new mark, learn to become familiar with your own skin. Take a few moments every month to check your neck, chest, back, arms, legs, and feet. If you notice something changing, don't panic. Simply pay attention and seek professional advice if needed. A few minutes of awareness today could prevent much bigger problems tomorrow. If you found this video helpful, take a moment to share it with someone you care about, a parent, a partner, a friend, or anyone over the age of 50 who may never have realized what their skin has been trying to tell them. And if you'd like more evidence-based health advice designed to help you stay healthy, confident, and informed as you age, be sure to subscribe and turn on notifications so you never miss an upcoming video. Thank you for watching, take good care of yourself, and I'll see you in the next one.